My name's Erica. I'm a freelance writer and mental health campaigner with lived experience of psychosis. In 2009, I was hospitalised after a suicide attempt, and it was a really bad time, probably the worst time of my life. In the run-up to that, I'd experienced moving around to different houses, I'd lost touch with book services, but there was no kind of record of me because I'd moved around. If that information had been digital and been able to move around with me, it might have helped prevent the hospitalisation and the suicide attempt.
Caring for somebody with a mental health difficulty involves lots of different people working across different health and social care organisations. What is critical, I think, is about communication amongst those groups, keeping the patient at the centre of that, but communication amongst professionals supporting that person.
What we wanted to do was actually have a model where a patient had one care plan and professionals could really access this care plan, edit and amend the care plan as the patient has touch points with different health and care professionals across the system. It quickly became apparent that in order to achieve this, we actually needed a standard, a digital standard to support this. Many systems were being used across Northwest London and nationally, it's the same story.
A key part of that is about how we share information through our technology systems, through our digital systems. That's a key part, not just about getting people in the same room, but making sure when they're not in the same room, they've got the information at their fingertips in the system from other professionals working around that person.
I've been getting involved in pilot research groups remotely on team meetings and giving some feedback on how shared care records have helped me and how sometimes not having shared care records has hindered my recovery and my staying well. So I've been working with a great range of people, from psychiatrists and doctors to nurses and other service users, to try and work together to improve outcomes.
So the care planning standard is really important because what it will do is actually enable essential information about the patient's goals, wishes, what's important to them, to be able to be viewed across different care settings. This has a number of advantages. It means that the care that we provide for our patients can be very personalised and tailored to what's important to the patient. We can also tailor care to try and meet their goals as opposed to providing sort of off-the-shelf care. It also enables patients to be able to tell their story only once, so they're not having to repeat their story. This is particularly important for mental health patients.
In 2012, I moved areas. I went from Stafford to Stoke-on-Trent. I was referred to a clinical psychologist. She came up with a care plan for me, which was mainly paperwork, but she was able to share that with the psychiatrist, which was really helpful. So we all know what my triggers are, we all know what my early warning signs are, and we've been able, since putting that care plan in place, to prevent a relapse in the future, and I haven't had a relapse since.
Oxley's was invited to join the consultation process for the PRSB standards for About Me. We fed into the discussions around what should be included in the About Me, and then once they were completed and signed off by the relevant teams, we introduced them into OxCare, which is our patient-held record. We also made it multimedia so that people could put it in photos, in videos, or just words, whichever was the best for them and easiest for them. One of the things we've introduced with OxCare, our patient-held record, is the fact that the individual, and it has to be the individual, can invite friends and family to join their community. And this will mean they can share certain pieces of information they want to share, and it will allow the friends and family to also become a better support network for the individual. What
the standards set out by the PRSB helps with is starting that conversation. This is what we should all be doing, and I think that's where we're coming from in Oxley's. We're sitting down with teams and thinking about how do we make sure that wherever you interact, whoever you interact with in Oxley's, in whichever team in that sense, you get the same standard of care plan. In Oxley's, we're taking it that step further, and we're not just saying, here's a nice paper version of that care plan. We're saying, how do we work this in the 21st century in terms of making that care planning process an opportunity for co-design, if you like, co-production.
Personalised care and support planning essentially is the delivery vehicle to support integrated care. because it's the tool that allows different care professionals to work together. It can act as a reference tool for different care professionals across an ICP, but it also acts as a patient empowerment tool. It supports the patient to self-care better.
I think it would help someone like me by ensuring that if I did have a relapse and I moved around, information will be able to get to the crisis team in a timely fashion. It would be digital, it would be at the touch of a button, there'd be no waiting around. My crisis team would know that maybe medication might help me in a crisis, so that information would be readily available to ensure that the crisis didn't get any worse and to ensure that I could get back on track.